So you told me today that you're writing your story.
Oh yeah,
Has that been fun?
It's been fun, but we've had contributions, from my residents and my fellows, and it's not always that the truth hurts, but you sort of find out you may or may not be who
you think you are.
You think you are. It may be that what others, but it's been good. It's been good. Because I've looked at it, I've been able to look at it, and you never get an opportunity to look at it and look back and see things, and so I actually didn't know what this would be about, and Jane just said, well, and I said, well, and I told her that, well, boy, I think a lot of it, so whatever she wants to do, I'm good with it. She said, well, she said, I don't know what to think about it. But then when you told me, you're going to just talk about some things, and I had the opportunity, I'm going to be presenting the life of a pediatric orthopedist in Philadelphia this weekend. And so that's where I had the images there that you can see them, and we can run through them pretty quickly. It's
good timing.
Yeah, no, it was good. And what I've got to do is that with the book there has to be a prologue and a postlogue, and we've done the prologue, and this is where you have a chance to change a few things, and so we're going through now. We've got the manuscript is pretty much there, but the editor wants to have, and this is New Wave, where the exit, since I'm still breathing now, hopefully I'll be breathing when the book comes out, to get some philosophical issues about what I think about things and so forth and so on. We're going to put that. And it's going to be trying, because I have a fault, and he's brought it out, and so we'll have to see what we can do with that. That's how editors are. And so we'll deal with that, and it'll be interesting to see. And I'm open, I'm game for anything. So we're doing that now.
We talked when we were doing your dance lessons about focus and your ability to be really focused on the job at hand. Of course, in your work, you have to be.
Mm-hmm.
Would you say that that's a big component of your success and your
That is what it's amazing. One, it's amazing what you can see by looking. I like to say that. The other is listening. And I tell my residents and fellows when they're dealing with patients, it's important what you can learn by listening. But it's hard to listen if your lips are moving. And so he wanted to know something.
Was this your editor?
And yeah, I mean, the people who've been involved in it. And you've identified it. And it's uncanny, because if you look at my life in the Times, you could see a person who could be really upset about a lot of things, social-political things, and so forth and so on. And he was really, well, actually, the lead editor, she wanted to know, well, can't you say that you felt this way and so forth? My mother picked this up, and it's not always the best. In situations where I've been under tremendous pressure and racial issues that have come up, I don't feel that I should empower the person who's a perpetrator by simply even acknowledging them. Mm-hmm. And I have the ability to do that. I can turn it.
That's a tremendous ability.
It is, but it's scary, because it used to always bug my wife, because women talk, and so there'd be something going on in the department in the medical center, and she said, "Oh, they're doing this. What are you doing?" And I said, "Well, that's their issue." I said, the only way you can empower them is to acknowledge that they're being mean to you. So you're being demean to me, it'll be a
But
secret.
then you don't waste time. You just,
You don't. You know,
just
and it
move
doesn't
through.
get you involved. So that's the issue. My issue is to take as good a care of patients as I can.
Keep
do
your
what
eye
I can
on
to
the ball.
And focus. Yeah. And that is something. It's amazing. You know that you said that, but that is what we have to have a post because he wants to know. Because there's several areas in the book that that people throwing grenades or whatever. And I just say, I got more to do than to do that. Plus, the one thing that I considered earlier is that if you've done something really bad that's asocial or whatever to me, that it empowers you to know that it was effective. My mother taught several things. She taught, your education. You get your education. Nobody can ever take that away from you. And you can go with that. You can be in prison. You can be in whatever, but your education be there. The other is to do what you feel is right and do it. And the fact that, and that was, I think, probably where I got it from, is that people who do bad things sometimes overjoyed how it affects you. And it's almost like passive aggressiveness, is that if you don't give them the satisfaction that they've done all these bad things to you, then maybe it didn't happen. You go with that. And so that's I mean, I've got enough to focus on, so I don't really have to focus on extraneous stuff.
we didn't talk about where you met your wife.
My wife is tough. My wife needs a medal. She needs more than me. No, in the 10th grade.
Oh, really?
Yeah.
Did you know then she was the one? No?
You never know who's the one.
Some people say they do.
You know what? I was reading somewhere, an article yesterday where a fellow saw someone and he went and told, oh, I know what it was. And it's not necessarily good. It's a woman that was just recently killed who had been from Australia, and in the New York Times yesterday, the fellow was talking about the life story, how he had met her, and he was an older bachelor, and he'd actually told somebody, he just said, I just met the woman who's going to be my wife. Before I got married, I think I may have met lots of women that I thought were going to be my wife. But there's another story, so we won't even go there. So.
It's the letter you showed me.
Oh, the letter that I showed you was a
From
letter
Hong Kong.
releasing me from an incubation period
Yes.
in Hong Kong. I had been a senior traveling fellow for the Scoliosis Research Society tour in 2009. I boarded a plane in Detroit, and we went to Narita in Tokyo, and it was just at the beginning of the H1N1 flu and the virus and so forth. Actually, we had been advised that it may not be a good idea to do international travel. Yeah, but we had when you fix an international tour, there are places that you have to be in times, and it just, if you don't do it, it took me 9 months to set it up, and to unfold that, it would do it again. So we decided to take a chance here because we thought it was actually on the decline. But anyway, a woman who was about 2 rows from me was admitted to hospital in Tokyo with the virus, with a temperature, and of course I didn't know anything about that. I went on, that was actually just a stop on my way to Hong Kong. Was in Hong Kong, gave a lecture, we were planning surgery the next day, went out to dinner, things were great. Got a call while at dinner informing me that there was someone in the hotel lobby who wanted to see me. I said, fine, we're having dinner. I think we'll be in maybe 10 or 11. If you can tell them, or they can give me a call. I can see them in the morning. And I said, no, there's someone in the lobby who has to see you. And I said, well, then he said, we'll come get you. I said,
we'll come to you.
What is this all about? Anyway, they came and escorted me directly to the hotel.
How many people were there to take you?
There were 6. Yes. And, it was... It was politically good because only one came to the cafe, to the restaurant, and so.
What about the people having dinner with you? That was okay because
They said, well, you know how that goes. When somebody comes to get you, everybody wants to say, well, you know, we don't really know what you were doing last night or whatever, how we answer. But they recognized that it was, you can tell by uniforms when people have authority, that they have authority. And it was probably the better part of valor that I would go with them. So I went back to the hotel, and the first thing they did is the hotel desk person had a fever gun, and so he immediately put the fever gun on my head, and he shook his head, but then they said, you'll have to get your things, you're going to be leaving the hotel. And I said, no, we have to be here for 3 days, we're going to Beijing. He said, no, you're going to be leaving. And I just said, well, I guess. and I called the junior fellows. I was a senior drum. I called them and said, well, I don't know what this is all about, but it looks like I'm going to have to leave. And you've got this schedule for tomorrow. The case is already there, and the chief there will take you through them. I was going to do them, but I think it'll be okay, and I'll let you know. So they took me through the service elevator down and got into an ambulance with sirens blazing. And everybody was in bunny suits, you know, the bunny suits with the relative.
yes.
And so they put
What
the
about
bunny
you? Were
suits
you?
on. No. I mean, I was, because I was diseased, they were protecting themselves from me, not me from them. And we went, it was the Princess Margaret Infectious Disease Hospital we were in. They disrobed me, and they cultured every orifice.
Did they spray you down?
But they put me through one of these things that's really interesting. It's a true infectious that you go into one corridor, they seal that off, and then you go to the other corridor, and then seal that off, and that's where I was. And I was there.
They were taking this very seriously.
Let me explain that. It was because of the H1N virus, and apparently the Asian community, when SARS came about, did not take it seriously enough. And many people died, and they weren't going to let that happen again. And so anyway, they took me, they cultured, and everything was fine. And then I had my things, I had my clarinet, I took my instrument everywhere. So I got in some serious practice. I didn't have anything else I could do. And
always be prepared.
I thought I had an out, though, because I found out that the professor at the Duchess of Kent Hospital had gone to school with the Minister of Health. It was one of his classmates.
How did you find that
out? He got wind of this because they were going to operate him the following day. So when they showed up to pick them up and they came to the hospital, they said, well, where's Dr. Crawford? I said, well, he's somewhere. But he told us, and he said, oh, well, let me check into that. So he checked into it and found out where it was, and then he wanted to call his friend, but he called back and he said, you know, my friend is just as much up against it as you because there's been a problem there. He said the real problem is that they now have an incubation period, and it looks like you're going to spend 10 days.
Wow.
And I said, well, okay. But after 48 hours of being afebrile, temperature-free, and all of my cultures came back, they said, the incubation period is still there. We're going to discharge you from hospital, but admit you to an infectious disease camp. I said, I don't know what this is all about. Anyway, so I had to wear a mask all the time. Took me in, they signed me in, and there were a group of people there, but we had to be isolated. There was Tamiflu, which is an antibiotic, a chemotherapeutic medication that I was required to take. They assigned me to a bungalow. I went to the bungalow. The infectious disease camp was a former Chinese Boy Scout camp.
You went in first.
We went there first because they had to see my arrangements, the living arrangement. And I was living in a little bungalow.
How tall?
6'3", and most of the Chinese boys aren't 6'3", and so the bed was appropriate. I had probably a good not a foot and a half, but a good foot out towards my legs. There was off of it. And and it was a whole 9 yards. I mean, I was served. They would bring my food and slide it on the bed in the door, and that was it. So they cut the incubation period from 10 to 7. So in 7 days, they said that I'd be able to go. And then from the Chinese University Hospital of Hong Kong and the Duchess of Kent, the chiefs came in a limo, and I got the penthouse suite
Then you got the other treatment
in Kowloon at Hong Kong. Oh yeah, oh no, that was they really did it good because, well, nobody had expected that.
Yeah.
And my team had gone to Beijing, but that was the only part. We had, I think, 7 areas. So then immediately we boarded the flight for Tokyo, and I met it again. But the people at the airport hadn't been informed that from the 10 to 7, and they saw my passport and they said,
you're
not ready yet.
They didn't give you a paper of release?
No, I think I showed you the document.
Yes,
they gave me that. They didn't give me that. They sent me that.
Later.
That's official document. But what they had given was that a discharge. They gave me that. However, the clerk at the airport assumed that there had been an error because it was 3 days short. So we had to, we had to work through that, and finally they said yes, I could go. So I went on to Tokyo and spent the time in Tokyo and on to Korea and to Singapore.
Were you doing surgeries?
Doing surgeries, and as I said, it's your sort of the Boy Scout leader, Girl Scout leader, or whatever the fellows are, and it is set up from the Scoliosis Research Society, which is, I think, it's probably the premier spine society of the world, and they take their best and brightest. There are 3 of them, and they have a senior person who has been there, and I'd operated all of those countries before, so I knew people there, and they knew me. And we went, and it worked. And it was more to show them and to introduce them to the concepts of Asia. The society does it alternate years of Asia and Europe, and I had the Asian tour.
And you had an adventure.
No, it was published. They put it in Orthopedics today, the magazine. Oh yeah, no, I was.
You were a star.
Things happen to you. It's sort of like, and people said, things happen. I was once president of the Scoliosis Research Society, and when you're that, you attend every world meeting of the organization. So I was at.
So things will happen.
Look, I was at Göteborg, and we had gone to Sweden through Paris. Well, I think Galton Allen goes to Paris, but at that time there was a stopping point. And so I had a meeting with the Minister of Finance in Paris because there's a group of spine surgeons that were contributing to some research projects we had. And so at 10:45, I left Charles de Gaulle, and about maybe 2 hours later, we were over Greenland, and it said, I have an announcement to make. May I have your attention? And it said, the United States is at war, martial law has been declared, and we will not be able to land in the United States. And I said, I think I need a drink. And so, and what they said was, no, we're not going to be serving drinks because we have a limited amount of water, and if people were drinking enough, you're going to get dehydrated, and we don't have water. So we landed in St. John's, Newfoundland, and we were trying to figure out, well, what the hell is this all about? And we found out it was 9/11.
Oh my!
And 9/11 was within 10 days of my meeting. It was my meeting of the Scoliosis Research Society. And so we landed, and we went to St. John's Presbyterian Church, And it was really interesting. You'll have to think of September in Canada, and that's the exhibition season for hockey, for ice hockey. Mm-hmm. And the teams are going through the small towns. There are no hotels in sight. So we stayed with the church ladies at the at the Presbyterian church. And they had air mattresses on a hard floor. And boy, if you're 6'3" and you're getting down on the floor repeatedly. But then, as you can, we first went to a center. There was a Red Cross center there, and we went there, and that's the first time we saw the teleprompters and the sequence of the planes over and over and over going into the World Trade Center. But anyway, that ended up.
How long were you there?
I was there for 6 days, and the reason is that we were one of the first in. It was a 4-plane tarmac, and I think there were like 30 planes that had come on, and so it was meaning it was first in, the last out, and so we had to wait until those. It was really interesting. Women could take a bag. Men couldn't take anything. It was because nobody knew anything. We were on Delta, so they processed us early. The Royal Mounted Police came, and they went through the American and United, and they had to stay. And I take it was because American and United were the airlines that were involved in it. So, it was sort of like I didn't know there was this cloud over me. And the other thing, it's amazing how you have committees. It was the meeting committee, and I'm the president. It's an international organization. So I called my executive committee and say, we've got a potential problem here because 9/11 had hit, and some countries weren't allowed to travel by air to the United States, some of the Asian countries and others. And so the real question is that there's lots and lots of money involved in this, and so whether or not to cancel the meeting. And I think the AMA, the cerebral palsy, and one of the other meetings had been canceled because of this, because they weren't going to have people there. And we paid all the hotels and so forth and so on. And we're 11 days from the meeting. So I called everybody and I said, what are your thoughts? And so the consensus was that, Al, we got your back. Whatever you want to do. And so I said, I'm sort of a risk taker. So I said, let's do it. And it was unbelievable. The hotels were very nice to us in terms of our registration fees from countries that wouldn't allow their people to fly and come. Those members who had registration fees in who could not attend waived that and gave it to the organization. And the hotels that we couldn't do, they didn't hold us responsible. So it was a bad situation. The meeting ended up as a profit because of so many people, and the members were just so genuine that it worked out. So it's another one of those things that sort of happened. And
so you are a risk taker. You told me about the Marine.
Oh yes, that was in terms of injury.
Advised to amputate his leg.
No, it had a mortar round that was through his leg, and I was a senior resident then.
This was during your time in the military.
This was in 1967, and in '67 I would have been a junior resident, and that even makes it worse. But this fellow came in, and the chief had him on the amputation schedule for the next day, and I was going to do it. I said, well, we can't do him. He said, well, because he doesn't have any bone in the top of his leg. It's been blown off. I said, yeah, but he has a good blood supply and a good neurologic. And you always told us that if the blood supply is there and the neurologic intact, then that's a reason to salvage it because they can be functional. He said, well, we think it's going to get septic. But if you get septic, you're going to be in real trouble. You could die. I mean, a lot of these kids are coming back unhydrated, and it's a real risk. So, well,
that would be on you.
Oh yeah, no, I would not. Had it not worked as well, I would not be an orthopedic surgeon today. And he made me painfully aware of that. But that was what the teaching was, and I thought we could hydrate him here. He was in the United States, we were in Boston, and I thought we could do it. And anyway, to make a long story short, it worked. And his wife called me pretty much 30 years a week before the date and asked me if it would be possible that I could see her husband. I said, sure, I'd love to see him.
Was that a surprise for him?
What she had done, because he had talked about it, about this doctor who had saved his leg, and he told his children and everyone. And so she just looked up to see if I was still alive or whatever. And so in '67 they came in. She was really into it and informed the Enquirer. It was a big article in the Enquirer. But you didn't see the Enquirer article because it said stubborn doctor saved leg. That's what it says, rather than a skilled surgeon.
Right, stubborn doctor.
Yeah, right. And it was there in a picture of the drawer. But it was really good to see him. And he talked about, having kept up. When I was a junior resident, I had a ward of casualties because, the senior resident gets the good stuff like joint replacements, the elective surgery, and all that. Sometimes the junior resident is just cleaning out pus, doing ward, doing amputations. But anyway, that worked out. So 30 years later, I got to meet his son and his wife. It was really good, and I kept up with it. And I was just looking at that this morning because I was preparing something for the medical students at the National Medical Association meeting, and I found out it's another 10 years. That was 2007. So I'm going to contact him today.
Oh, really?
Yeah, yeah. Because so that would be 40 years.
Yeah, his birthday.
Yeah, that's a big one. So, anyway.
So when you first came in today, you told me there were unintended consequences of your new dancing career.
And I don't know where this is going, but if there's anyone who's interested in getting involved with quote-unquote dance, they need to see their physician first. No, I was getting an insurance policy that had to do with an endowment and so forth. And, the underwriters are looking at every single thing. So they sent a person out to examine me, and it went well. The labs are really good. I was happy with the labs. But I got a call from an adjuster. They use outsourced adjusters. He called me and said, well, we got a problem. I said, really? He said, yeah. I said, well, my labs are good. I said, I'm actually a physician. I looked at the labs. They're all good. She said, well, it's not bad. I said, well, what is it? She said, for whatever reason, your annual physicals, and they've gone back 2 or 3 years, we show you to have, since August, a 15-pound weight loss. I said,
unexplained.
Unexplained weight. So, I didn't, to be honest with you, I didn't think about anything. And I went back, and I told my wife, I said, well, I think they think something's growing and eating me away. I've been sick or anything. And, but I've lost 15 pounds. She said,
so your wife didn't know?
She said, oh, because see, there's a dirty little secret. There's always a secret. I would spend my time with you, and it would be once or twice a week, but I wanted that thing to go well so that I'd be at home every night dancing another hour or so. So what I didn't realize, she said, it has to be that. She said, I noticed you're losing weight, but I wasn't going to say anything about it. I said, oh, really? She said, yeah. She said, that has to be what it is. And I thought about it. I said, I think that's it. And so I couldn't convince, well, the adjuster couldn't have convinced the underwriter. I said,
they don't think a foxtrot would be that.
So what I did, I said, look, here's what I said, I saw that on YouTube. It says it's Dr. Alvin Crawford dancing. Why don't we send that to the underwriter, and we'll wait to see what his response is. And she did. And then about 3 days later, I got a call that I'd been approved.
Okay.
Fine. Whether or not they'll recommend other of their and their insurance people to do this. As far as their clients are concerned, I don't know, but it's been good for me.
So you were even more dedicated than I knew.
Oh, yeah. The thing about it is that it's amazing what people think about you. And I noticed that one thing that the dancers, when there was the little promo thing that you give at the beginning of it, it was noted that I was in shirt and tie at every one of the practices and so forth and so on. And I commented on it. She said, "That's just him. He'd have a button-down shirt if he were going." That's just what he is. So I thought that was a great thing. It wasn't something that I would have elected to do ordinarily, but it was really good.
How did you get involved? Did someone nominate you?
Someone had to.
And then they contacted you to...
It was really one of those things that, quote unquote, I know he won't do that. And
there have been others.
People should be aware of that there's certain people with a certain ego level that's a caveat, that's a hook. They can get him. If they put it there, well, I know he's not going to do this. He wouldn't be. And that was it. And I said, what do you mean? Don't do that.
You are a risk taker anyway.
It's not over till it's over.
So what surprised you about that? Obviously how physical it could be.
It gave me a different opinion and respect for dancers and what they go through. That is, it's unbelievable. I mean, the timing of things, and the amount of effort. It's not just, you're just sort of moving around a bit. And especially when I saw, now, I think I've got a pretty strong ego. At my 2 o'clock session, the day I was ready to report in sick, you're talking about intimidation. Seeing the professionals do it that I was just not aware of. And it just gave me a bit of more of respect. And then the physical part of it, yeah, it's daunting. But it's like any other profession that is involved with physical activity. It's got to be in good shape. That's why dancers have your body happiness. You have to. Yeah.
But you've also been an athlete. Tennis.
Yes.
Sports you've been involved in.
No, tennis was my passion actually. After residency, and I played earlier. But then...
Did you play in high school?
The military was... I actually played in college. The military was an area... the military is really, really good. They have times for things. You can make time to do this. And physical activity is important. And I was in Boston, I guess, from 64 to 71, then went to San Diego. San Diego is God's country on earth, especially for tennis. And... I played for the 11th Naval District tennis team there, and then played in the All-Service and won the Southern California All-Service. The year that I got out, which was 75. Before that, I had become really involved in the academics, and I didn't have as much time, but then I was getting out. And I said, I need to give this a shot. I'm pretty much that way about everything. I said, I need to give this a shot and play. And that was good. And actually went to the regionals and the whole thing of all service. So that was the best of my tennis.
Do you still play?
I don't play as much. I tore my Achilles tendon in 2013, which was a surprise.
Playing tennis?
Playing tennis. Oh, that's, yeah. And didn't expect that. And I was good. I recovered. I had good treatment, and I came back. There was one problem with it, is that I would go for any shot, and actually that was a part of my advantage that I went. In tennis, it doesn't matter what level you're at. There are few times a player can overpower another player. You could be big and have just an unbelievable serve, but as you get to a certain age, you realize that you win matches based on your opponent's error. And so the more chances and opportunities you give them to error, the more successful you're going to be. So getting to every shot and getting it back was my game, because I mean, I have a big serve, but that left about 10 years ago. And so that was it. But I noticed that the ball would come over and I'd get in position, and I was just ready to go for it. And I think about what happened in the dressing room. I was at the Hyde Park Tennis Club, and I was coming out of the shower, and I said, "Hey, Doc, I heard you tore your Achilles tendon." I said, "Yeah." He said, "How's it going?" I said, "Oh, it's fine. I'm hitting really well. I've played a lot of matches." He said, "Well, you know, I think it was 1986, and then it must have been, let's see, that was a left, and 91, that was a right." By the time he got done, I said, "You know, I don't think I want to go through that." It was good, meaning the rehab and so forth and so on, but then I was on this thing called a roll-along. I don't know whether you've ever seen that. And I was seeing patients. It looks like a little scooter.
Oh, yes.
Yes.
When you've had a foot surgery.
Yes, you'll see that. And I was to the point of even doing wheelers with it, for my patients, and I'm saying, shit. But you know what? I didn't care to have that. So I found my next passion after that and now I do stairs. So I'm on the 5th floor, so I don't take elevators during the day. So I'm trying to, I've got to stay in shape.
Stay fit.
Yeah. And I am really fit, and I may go back to tennis. I actually won a tournament here at the old indoor, the tennis club here. So I continued, and you get into that. And this year, and for want of a better language, I'm going to say old farts. This has been an unbelievable year when you think of at the Australian Tennis Open, they had Serena Williams and her sister. They're the oldest tennis players alive on the circuit on the women's side. And then on the men's side, there was Roger Federer and Rafael Nadal. And they're for tennis, they are ancient. They're all over 36. And I said,
really old.
No, for professional
Right,
tennis, yeah. When you start, 3 and you're champion at 10 or 12. But and then Federer just won the Wimbledon just a week or so ago. And then Serena reveals that she was 2 months pregnant when she won. So no, I'll get back to tennis.